So let's still start from review from last week. So we are in the West diagnosis class. So basically, whatever TCM or West medicine diagnosis, we will separate with two parts. One part, we take the informations. Like we ask patients questions, and then we checking for the patients. After we got all the information, then we talking about what's the illness or TCM part. So basically the same idea. For Western medicine diagnosis, similar, we still separate with two parts. We say one part mainly take the information. We say ask questions. The second part, we say physical body examination. So that's take the information part. Then we separate it with another two parts here. So basically we use the first class. We're talking about ask a question part, like a chief complaint, personal illness, history of the illness, and the personal habit. Then we go to examination part. So that's the big part. Yeah, that's the big part. We use one class, go all over physical examination. And then last week, we use another class. We talk about generally what we examinations. Like we start from the head, but before go to head, we talking about some vital signs. So that's basically we talking about before. So that's we say physical examinations for Western medicine, we including the full part. Inspections, just looking. We're looking from the superficial of the skin, or maybe we're looking from the head to the toe, all over. And the second way, physical examinations, we're talking about palpation. So palpation is use our hand to touching the patient. We can slightly touching, lighter palpation, or maybe with deep touching. That's deep palpation. Then the special way we use for TCM, we call it percussion. Percussion is used the way, use the fingers, tap the patients, and then we hear the sounds coming from the tapping. So basically it's hear the sound. Palpation just the tapping, lightly and deeply, but don't have special kind of sound. Percussion truly we hear the sound. We have directly percussion, means use one hand finger directly tapping the patient's body, then hear the sounds. Another way we call indirectly percussion. Thus, generally we use two hands. One hand is under, and then another hand fingers touch your hand or fingers, then still hear the sounds. So that's we call percussion. The fourth way, aspirations. Aspirations is use special kind of scalp, also called Sweartz, so that still hear the sounds from the patients inside. Mainly for the sounds coming from the lung and the sounds coming from the heart. So that's the basically physical examinations. We have 4 different techniques. Then last week, we're still in the review part. So then last week, we also talking about general examinations. General examinations basically including 3 parts. We checking general body's conditions, certainly for the people, for the patient. Then we checking for the skin and under the skin subcutaneous tissues. Then the lymph nodules. Thus, when we talking about the general examinations, we checking with these 3 parts. But in each of the parts, we have some detail. What we checking? So the first part, physical condition of the patients, we including 8 different aspects. The more important is the vital signs. Vital signs mainly including body temperature, respiration rate, pulse rate, and blood pressure. So these 4 aspects is so important. It's directly relationship with people's life. Like a temperature dropping down or respiration rate, heart rate dropping down, and blood pressure dropping down. Mostly people will be in very, very severe kind of condition. Maybe died. Maybe died. Even go up by the different degree. Still severe kind of situations. So that's why we call these 4 aspects together is the vital signs. Means show you how your body's life quality in there. Then we talking about the development. Relationship with how high it is, how body build, and how weight. And certainly from the how high it is and how weight the people, basically we can calculate for a patient's nutrition state. We use our words BMI. BMI basically including body height and weight. We calculate. We have number there. So that's basically between that number, so about 18 to 25. Between that number is normal. Over is overweight or opposite. Low is poor nutrition. So that's we can calculate there. And then we look in patient's spirit, consciousness or losing consciousness. And we hear the patients speak the tongue. Looking patient's face. And if patient like just lay down in the bed, like a severe kind of situation, we look in the position in the bed. And we separate active position. That's basically patient moving freely. And the positive position. Because the illness, patient can moving, but they must be keep some special position, making it comfortable. Like patient always lay down by the right side. If they moving to the left side, they will be cough, severe kind of cough. So that's make it keep lay down on the right side. And another kind of situation, patient totally couldn't move. Just keep some special kind of position in the bed. So thus we have three situations. Then we looking patients walking or sitting there, how they look like. And then we got some basic idea. Generally patient's physical conditions. So in this part, still more important part, vital signs. That's the one part. Another part, state of nutrition. In other words, how to calculate BMI. You are not necessary to calculate like we have a chart. You just need to know how to use the chart and then find the patient's BMI. So that's our chart here. So you know, you can use the weight. This side is the how many pounds. This side is how many kilograms. The same. Result will be the same. But some people know their how many pounds. Some people know how many kilograms their body weight. So you are easily to use. Maybe go to left side, maybe go to right side. And then how high it is. How high it is. We still have centimeter and how many cun here. How many inch and cun here. So you just pick up one of them. And then you make the line meeting in some area. If meeting in the blue color area here, anywhere in blue color, that means normal. If meeting in the white color here, two lines meeting together, that means underweight. Underweight. Thus generally say patient poor nutrition. If meeting in this little bit yellow color here, little yellow color here, that's overweight. If meeting in the pink color here, whatever, that's the opposite. Certainly, they still have some line in here. Moreover here, more severe. So that's basically this chart. You should know how to use it. How to use it. You are not necessary to calculate, but you just use this chart, and then you can find the normal body weight or BMI. And certainly need to remember the normal BMI range, the number. Like you got the number here, but you know that's normal or abnormal. So that's the first general part. First general part. And the second general part, we say we go to skin and under the skin tissues there. In this part, we still including lot of aspects. 10 aspects. So generally skin color is normal or abnormal. So that's basically by patient's original color there. If the color not changing, like naturally, that's the normal. If the color recently changing, that will be abnormal. Whatever the original color should be normal color. It's not especially like a different kind of people, their skin color difference is illness. By their original color still keep the same, that's normal. But changing, that's abnormal. Then we're looking for moisture. Normal skin is the moisture skin and elastic. Then we're looking some skin damage, like skin rushing. Skin rushing is abnormal kind of condition. Some people have skin rushing. Then we're looking the color and the shape and the locations. And some people may have some blister under the skin. That means some bleeding under the skin. And a special kind of signs, spider kind of enlarging blood vessels, basically like this shape. That's usually patients' liver have some disorder. So that's the size. And some patients will have edema. Then we look at some people possible have under the skin tissue, they may have nodules there. Not only lymph nodules, we will separately talk about lymph nodules later, but here just generally nodules, some nodules, like some tumor under the skin. Then we looking for the scar under the hair. So basically, we are not truly make diagnosis. We say we just pick up the information here. We record all the informations, then we put it together. So like later when you learn some internal medicine illness, they will talk about. some symptoms or maybe some signs, especially go to some unit, like we talked about the liver unit. So that's generally the skin and skin tissue there. So just some pictures show you different, that's the skin rash here. That's under the skin some like bleeding there, booster. So that's spider kind of skin issue there. That's edema. That's nodules. Yeah, that's nodules under the skin. That's scar tissue. Yeah, that's scar tissue. That's naturally happens. That's after surgery. So surgery kind of scar, you can see that's the scar tissue here, and then you can see some line like this. That's basically after surgery, and use special kind of wear and fix it. And after the skin absorption the wear, and but still leaving the scar tissue. Then the third aspect, the third big aspect, we especially go to lymph nodules. So that's mainly a big part. So lymph nodules, everybody should be have. Yeah, normally everybody should be have, but it is very smaller, very smaller, and especially located under the skin, and maybe some muscles there and under skin tissue there. So you're hard to find your lymph nodules. Like normally people couldn't find it, even they are in there. Occasionally you can find some of them, but still softer and no pain, and superficial very smoothly. So that's normally lymph nodules. If the lymph nodules getting bigger, and then truly we can find it. And we will looking for lymph nodules, the location, where it located. Because from the location we will know like which part of the body or which organ have some disorder. For example, we're talking about the lymph circulation. In the lymph part from the terminal to the center. In the organ part, similar like blood vessels, they coming from the hair-like part of the lung, and then like a blood vessel artery go to like all over the lung, but the vein go back from the lung tissue, go back the hair-like of the lung. That's like a door in here. Blood vessel passing route and the bronchi passing route. That's in here. The same thing, lymph flowing. Same thing like the vein. They will go to this part of the lung also. So sometimes people can find like some big nodule here. We say that's big lymph nodules here. Then we check in the lung carefully. It must be in some part of the lung, maybe have a cancer there. So depending different pattern of the cancer. some lung cancer may be more locally, getting bigger and bigger. Some cancer may be smaller in the lung, but they transform to the lymph nodules. So thus we say, from the location we know where have troubles or illness. Then we're looking for the size, how big it is, and how many lymph nodules. And we checking it is softer or hard. And if they painful or not painful. The lymph nodules is mutable or not mutable. Then superficial skin color is red color or normal skin color. Is swollen around the nodules or not swollen, or even some scar around it. Then mainly we're looking for like what's caused lymph nodules getting bigger. So basically, generally say, lymph nodules getting bigger, we have three pretty common reasons. The first common reason is inflammation. And then closed area lymph nodules will be getting bigger. So thus some people go to sore throat or common cold, then they got neck lymph nodules bigger, or even toothache. So that's lymph nodule flowing way. The second common reason lymph nodule getting bigger, patient get cancer, just like this case. So some cancers, they still can cause the lymph nodules getting bigger. So when we're touching for lymph nodules, we still can find like the difference. Like inflammation can cause lymph nodules bigger. Basically, it's softer and maybe a little bit painful and mutable. But cancer causes the lymph nodules bigger. It usually is hard. Early stage, no pain. Later stage, severe kind of pain. So that's cancer cause. And not mutable. They fixed. Like a few lymph nodules fixed together. And the skin is more reddish, more swollen, and more numbers, and big size. And another reason is blood systems illness. Still can go to lymph nodules getting bigger. But remember, blood system illness, they will cause not local. So basically these two is local lymph nodules bigger. But if patient have blood systems illness, their lymph nodules all over the body will get bigger. So that's some difference here. So that's basically last week we talked about the general examinations. So that's even from the picture we can see totally different. This here is some bigger lymph nodules, and here is some big lymph nodules. So we can see some difference. Certainly, this one is more severe compared with this one. So this one generally say possible is inflammation cause, but this one is possible cancer cause. Certainly, we need other way to make diagnosis, not only we are looking, but give us some basic idea. So that's coming from our last week. Generally examinations. Any question in this part? So let's go to today. So we say then we will checking the patients from the top to head, from the head to the bottoms of the feet. So we'll go all over one by one. So today we go to the head and the neck. So with physical examinations, we start from the head and then go down. We put the head and the neck together for today. So we checking for the head first. The head part, we're looking from superficial, the hair and the scapular area first. Then we looking the skull, means the bone. Then we looking the face part. Face part mainly we have 5 orifices there. So that's the head part. So for the head part, basically we use the inspections. With the Western diagnosis, we have 4 ways to checking for the patient. But for head part, mainly we use inspections. So just looking, and looking the position of the head, if they have some troubles, and if both sides is the same, or face both sides is the same. And we also to see like the scalp area, if some damage there, or maybe some part losing hair. So that's basically we're looking. So in this part, look like a pretty similar. And maybe for the adults, nothing have big changing. But for the new babies, certainly sometimes they may have some disorder. And for the new babies, we also looking for the fentanyl. So that's the normal space for new babies. We generally say the babies have 6 fentanyl. In this picture, we only can see 2, and another 4 on the side. that's pretty normal situation. So basically, if you're looking, it's generally say you're hard to find anything wrong. But if you touch it, slightly touch it, then you can find the eye. It's pretty soft there. So that's the biggest one in anterior part of the head. Yeah. So that's the bone and the bone connect the eye. So these bigger fontanelles, basically they will be closed under 2 years old. Yeah. That's normal development. If some children over 2 years old, yeah, we say normally 6 to 18, but we can think about 24 months. If over 24 months still not closed for their fontanelle, that's truly the children poor development. And the others close even early. Yeah, others close even early. So that's the biggest one. So that's the fontanelles. Then we're looking for our orifice. The important part is the eyes. So checking for the eyes. Certainly sometimes we use special kind of tools, but truly we can just use our hand and then we can check in patients the eyes. So this picture here pretty similar like the video we see. We checking patients' vision field. So practitioner standing on one side, the patient standing on other side, and use the hand, both practitioner and the patient cover one side. So that means the practitioner cover the left side, and they face to face, patient cover right side of the eyes here. And then use the fingers gradually moving from the side go to center part. It should be like both practitioner and the patients see the fingers same time. That's normal. Keep the eyes touching each other, not directly moving to the fingers. But you can try, you can try yourself. Even you're looking for a friend, but your finger moving gradually, moving inside, you still can see the finger moving there. So means practitioner mainly is normal situation. If patient can see the same time, patient is normal. If practitioner see it already, but the patient couldn't see it, means patient's the video size is smaller. And after finish one side, changing to cover other side. Both changing cover other side. And then try to use finger to other side. So that's checking for vision field. So normally our eyes can see the light go in. So that's the normal eyes here. And then the normal vision field just like this. So that's the left side of the eyes That's right side of the eyes. Like my eyes can look in. Yeah, what I can look in. So we say normally left side. Yeah, left side. That's more clear vision part. Yeah, more clear vision part. That's right side, more clear vision part. And put these two pictures together. You can see normally in the center part, like a two-side vision, they will be together. That's mainly our daily life we use our visions. But still, we say both sides they still have some part, maybe just one eye they can see. Yeah. That's the left side they can see only. This part is the only left side can see that far away. This side here is the right side eyes can see. Yeah, just thinking about put these two pictures together. Then form the picture like this. So that's our normally vision field. So that's we test for vision field. Just simply use our eyes compare with the patient's eyes field. Then we can find normal and abnormal. So that's basically just some explanations here for last picture. We say we sitting 3 feet face together each other, and then ask patient close one side of the eyes, like in the picture. It's not closed by herself. We use something cover. Yeah, we use something cover. That's easily to changing eyes later. And the practitioner or examiners cover other side of the eyes, but they are faced together, look like the same side. And looking each other the nose. Yeah, looking each other the nose. Then put the fister with plum face here, and then show 1 or 2 fingers, and to ask patient if they can see the same time. Yeah. If the practitioner can see it, if the patient can see the same time, that should be normal. Yeah. And then looking at like upward, downward, different directions, then we can see how bigger the vision look like. After finish one eye, then changing to other eyes. So that's basically test to vision field. That's one test we can do. Yeah, we can do. And if patient losing some vision field, yeah, how we can make a diagnosis? Yeah, how we can make a diagnosis? So these pictures show us that means brain here. Yeah, that means brain here, both sides. That's the nerve branch. That's the nerve branch. We say the cranial nerves. Yeah, cranial nerves number 2 go to the eyes. We also name it optic nerves. So that's together here is optic nerves, both sides. For optic nerves, they go to the eyes. They separate with two branches. You can see the blue color here. Basically, they go to lateral side of the eyes here. When they receive the light, they receive opposite of the light, go to inside the eyes. So generally say this part, the light or something we can see, go to this part of the cornea or visions. And the opposite side, temporal side vision, go to middle side of the eyes. In other words, if the patient like a totally one side of eyes, no visions, it must be something happens between here and here. It's damaged here. So totally does look like this side, left side eyes losing the visions. But if not the whole eyes, if the only one side, for example here, no vision here, thus the problems will happen in here. But other side vision is normal. Thus usually problems is here. But if we go to other eyes, the vision have trouble here. And we still say in the retina area, the problems in here. So if both sides the same half losing the vision, you see they are travel away. They meeting together here. Thus possible some problems happen in here. Then they losing the same side, the same side vision losing. And another condition, like if some people have some trouble in here, like a tumor in here. So what's the blocking the vision will be? So this three band here will no functions, and losing the vision and here. And these three bands go to this part. They will no visions, so no vision will be here. So that's why we check into the vision change. Patient different kind of vision changing may be reflections for different part of the nervous band have some disorders. So that's our next picture here. We say this one, that still means left side, that still means right side. Both eyes have both side vision disappeared. Couldn't see anything on this part. Then we go back last picture. we say if they go to the same side, yeah. If they go to the same side, vision losing, that's in here, and the meeting together part is here. So must be something happening here or even in the brain side, brain part. Caused. And then next situations. The patient losing the visions, both lateral side. Patient losing the visions, both lateral side. That means they couldn't see anything. Trouble happens in here, and trouble happens here. And then the visions go to lateral side. So that must be something happening here, and infected both sides. So that's why we need checking for the visions and the vision changing. Any question in this part? Yeah, you need a combination to see these two pictures. Otherwise, you don't understanding what they're talking about. Yeah. So that's basically clinical. We checking patients' visions. We looking if they looking some visions in some part, then we can diagnose it where the patients have some troubles. Another test for the eyes. We use convergence. Yeah, convergence. Convergence is pretty easily. We can use the fingers, or maybe we can use pencils, and moving from little bit far away and to the close to the eyes area. And then patient's eyeball movement will follow the path. Look like both side eyeball moving to the center. You are more close to the more moving to the center. Like I do something here, like I'm moving far away, then gradually I'm moving more close to me. I can follow. My eyeball can follow. And finally, if I can reach in 5 centimeter to 8 centimeter to the nose, I still can follow. That means normal. Yeah, that means normal. So that's the test for the convergence. Then another test we can do. For the eyes, we call it swinging flashing light test. So that means normally our pupil will be changing. We look in the size of the pupils, means the changing. So in dark room, yeah, generally say in dark room, the pupil getting bigger. And if we put some light close to the pupil area, the pupil will be changing to smaller. So that's the normal reactions of the pupil. If patient have this kind of changing, that will be normal. And also both side eyes, like before your test, should be normal, should be same. Like this one, little bit difference. If no test to do, that be abnormal. before the test will be normal. And if you put a light for both eyes, they still the same. That's still the normal. So that's flat light test. Still check for the eyes function. Certainly we don't have special kind of scope like the radio. That radio special kind of scope looking inside the eyes, retina area, like the color there, blood vessel there. We don't have special kind of scope, but truly we can do 3 tests for the visions clinically and give us some basic idea about people's eyes functions. So that's way checking for the eyes. Yeah, that's way checking for the eyes. Then we say checking for the ear. Checking for the ear mainly we checking the patient's hearing. So certainly we still have a kind of special kind of meter we can check in inner ear and their functions. But basically physical examinations we can just check in the ear with the hearing. So like the radio, like the radio show us, you can speak something with slightly sounds close to the patient's ear, and to compare, like which side patient can hear it, like a patient repeatedly, what words you have speak. And also sometimes you can use some sounds with some tools close to the ear, and then to see if a patient can hear it. And truly sometimes people, we test the ear, we use a special kind of tools like this. We use another things to tap these kind of tools, and they will have some vibrations and close to patient's ear to see if patient can hear it. So that's basically examinations for the ear. Then we're talking about the nose, checking for the nose. So basically, when we checking for the nose, we checking for the sinuses. Nose cavity itself usually nothing specially to checking. Truly, nose have smelling functions. You can put something close to the patient's nose, like alcohol or maybe some vinegar or whatever, and then to ask a patient what kind of fever they smelled. That's if a patient normally, they can tell you. And another important part, we're checking for the sinuses. So we have, everybody have 4 pair of the sinuses, but we only can checking 2 pair, more superficially, frontal and maxillary. So that's the frontal sinus. That's the maxillary sinus. That's we're looking from the side. So how we checking? So if patient have infection in there, like a sinusitis, then they will feel some like a tenderness in there, or even your pressure there, patient will feel painful. So basically by palpation. Palpation for the sinus tenderness. Pressure on the frontal sinuses. So that's this one, this picture. Put you some over the eyes, right close to the frontal sinuses area, and pushing upward, upward the bone there. Don't push in the eyes, pay attention, don't push in the eyes. And if patient feel more tenderness or let it be painful in there, so that means the patient have infection in there. So normally people will not feel painful or tightness. So basically that's we test for the frontal sinuses. And the same idea, on the maxillary sinuses. Still with the thumb, and put the thumb there and pushing upward. If patient feel some tightness there or maybe some soreness there, then patient will have sinuses infection there. So that's we test for the sinuses. Then we looking inside the mouth. We checking for the mouth and the throat area. So basically, when we looking inside the mouth, we looking for the tongue, for the throat area. It's normal color, normal shape, and no ulcers. We can use a light. We can use a light and tell the patient open the mouth, and we also can use small tools to help to open the mouth and looking inside, especially if you're looking like outside is throat area. We may use the tools pushing the tongue downwards and easily to looking. Especially for children, especially for children, they don't know how to open their mouths. And certainly, sometimes we may find some ulcers in the lymph area, and sometimes in the tongue or even on the gums. That's abdomen, so that's some ulcers here. We are not like TCM, especially looking for the tongue, like a color there or coating there. We're just looking for the general condition of the mouth and the tongue and the throat area. So that's the difference with the medicine with TCM. That's the TCM specialist for the tongue. And we're also looking outside the mouth, the skin. So we can see some special kind of skin rash here. So basically, and also around the nose area, even some bleeding there, blister in there. So this picture coming from one patient, they have hypers. So that's we're also looking around skin. And also sometimes we're also looking for the muscles. Means we're looking both sides, the muscles tense the same. Sometimes people after mid-stroke, one side of muscles more relaxed, and then the mouth will be deviated to other side, even the nose deviated to other side, and the eyes couldn't close. So that sometimes we also looking. So that's basically the head area with examinations. So that's basically we finish the head area. Head area is more important. We have orifice there. The mainly important orifice with examinations is the eyes. We have special kind of tests there. And certainly we also test for hearing function and with palpation for the sinuses, and we're looking inside the mouth. We put a cranial nervous test, like some feeling on the face and the movement of the face go to our nervous systems. So we are not especially talking about cranial nervous function right now. We put it later. Then we move into the neck. So neck examinations. We're looking for 3 aspects. The first aspect is the skin and some nodules, if they are in there. So normally we should without nodules. But sometimes people maybe have some nodules in the neck area. And we also looking patients' neck movement. So normally people can free to move in the neck area, but some patients may be stiffness in there. So that's the first aspect. So basically skin we just looking, but for the nodules we will palpation, looking and palpation. Yeah. And then we find the soft nodule or hard nodule, or mutable or not mutable. On the superficial, the nodule is smoothly or unsmoothly. And certainly neck stiffness, we need a moving patient's neck to feel it. The second aspect, we're looking for blood vessels, especially in the neck area. We have a big vein, jugular vein, external jugular vein, right on the neck area. So we're looking how bigger it is. So normally, when people sitting there or standing there, we couldn't see it. That's normal situation. When people lay down there, we can see it, but not over 2/3. We say from the clavicle bone to the angle of the joints area. So let's go to the picture to see how we calculate. So blue color here is external jugular vein. So we say normally people sitting there or standing there, normally we are not see it. So like this picture, truly we can see it here. That's abnormal kind of condition. And this one we need to calculate when people lay down there. That's clavicle bone. That's the angle of the jaw. So we calculate from clavicle bone to the angle of the jaw here. And cut 3 required parts. If the V not over 2/3 here, keep in this range, that would be normal. Certainly this patient is much longer. So this picture still abnormal. Yeah. Both these two pictures is abnormal kind of V in there. So thus we calculate for the blood vessels for the V in there. And the third part, we're looking for thread gland. We're looking for thread gland. So this picture just shows us some anatomy like angles in the neck area. So that's the clavicle bone in this area. And from the muscles, we form two special kind of area. One triangles, another triangles. So that's anterior triangle here. That's posterior triangle here. So if you find some nodules you mentioned, you can say you find the anterior triangle or maybe posterior triangle. So we just mark it or check it in different parts. So then we're looking for some lymph nodules. So lymph nodules can happen in any part of the neck. So that's like a posterior part still belong like between the neck and head area. So that's lymph nodules, behind the ear. And then we mention how big it is. How big it is. It's how many in there, 1 or 2. And the superficial is smoothly or unsmoothly. It's mutable or not mutable. Exactly the same like we talked about before. Just especially go to neck area. Then we go to especially palpation in the neck area. So we generally say we do inspection first to see where we find some problem or trouble. Then we palpation it. So when we palpation, like we can moving the patient's head slightly, and the patient's head is easily to moving. Follow the practitioner's hand. If hard to moving, that's we say neck stiffness. So that's generally we got some moving there first. So that picture show us palpation for the patient's neck. Just put a hand both sides, holding the head and slightly moving. And also you can, your fingers can follow the neck area, do some palpations. So that's firstly we checking for the neck. Then we checking for the thyroid gland. So thyroid gland is a big endocrine system gland located in the neck. So usually, we couldn't see it. But we can palpation for it. But normally, still hard to find the aging of the glands. So when we palpate, we can use the different way for palpations. We can go to the front part of the patients. We use one hand holding the trachea, fixed there, and then we use another hand to palpations for the thyroid gland. So normally, you just feel some soft tissue there. So that's normal condition. And certainly, if we were looking for the patient's neck, both sides should be normal. Trachea in the center, and our thyroid gland mainly location on both sides. My bad picture here, but normally they are the same. Yeah, normally you just see both sides neck is the same, and when you palpate, it is softer there. So if we look in one side is pretty bigger, that's abnormal. And even some people both sides bigger, still abnormal. That may cause by different kind of illness. And when you palpate, it is softer. And in the video, you see the doctors ask a patient to swollen, like some water swollen down. So basically, you put your hand there, and you feel the soft tissue there, and even sometimes you feel the nodule there. And when you ask patients swollen down, so basically, if the nodule follow patients swollen down, that means that is thyroid glands or maybe nodules on the thyroid glands. If the nodule there but not follow patients swollen down, means not moving. Basically, when people swollen down, drink some water, the neck area will be moving. The neck area, especially thyroid gland, will be follow moving. But if not moving, means that's not located on the thyroid gland. So that's basically we get some idea like where the nodule located. Thus we checking from the front part, and certainly after you checking for the left side of the patient, like we say, you switch. Use your right side hand holding the trachea to the right side of the patient, and use your left side of the hand to feel the thyroid gland on the right side of the patient. Just switch. Then we checking from the posterior part. So when we checking from posterior part for the thyroid gland, truly we can put 2 hands same time in the neck area, and then palpation there to compare. Both sides should be the same, same size and the same software. That's basically normally, and the location normally the same. So center part still trachea. We are gradually moving our hand, from gradually from anterior part moving to posterior part. Make sure your fingers cover both thyroid gland. So that's generally we checking for thyroid gland on the neck. So that's the normal location, normal location of our thyroid gland. So look like a edge here. Some people call it a butterfly. And the trachea located pretty in the center. And above it is a big cartilage. Because it is located in front of trachea, we call it infant trachea and thyroid gland pretty close there. So thus we call it thyroid cartilage. So that's basically we also call it Adam apple. It's pretty bigger in front of neck, especially for the male. Everybody can touch it, you can find it. So below it, below it is the thyroid gland. But normally you couldn't see it. If people have like enlarging thyroid gland, like a hyperthyroid gland disorder, you can find a big thyroid gland. So like next picture here. So truly for this patient, it's a pretty big neck here. Most situation is caused by thyroid gland. So you palpate it, then you find much bigger compared with the normal people. And certainly you can test it. Tell people swollen down. If the nodule here follow the swollen moving, that's truly thyroid gland disorder. If not moving, maybe skin or under skin tissues disorder. So that's for this picture. Then in the neck area, we especially try to find some nodules, like above the clavicle bone area. So that's basically we say lympha nodules. Mainly is lympha nodules in that area. So these lympha nodules mainly coming from internally the chest area. Patient have disorder there. We still go to our anatomy picture here. So that's our anatomy picture for our neck area. That's the clavicle bone. So some nodules may located in this area. When we talking about lympha nodules, we say like in the chest area, especially for the lung, thus easily cause the troubled air. So mainly lung issue. They cause the lymph nodules bigger, close to the lung area first, and later on they possibly transmit to the above clavicle bone here. So that sometimes if people got big lymph nodules here, possible coming from the lung, possible coming from the breast tissue. But breast tissue is depending like which part. Side part of the breast tissue, they go to under axilla area, get big lymph nodule. Middle part maybe go to above the clavicle bone there. So if we find some big lymph nodules there, so mainly internal organ disorder, maybe breast tissues disorder, we need more checking. So that's we looking for the lymph nodules if they bigger in that area. So that's we say palpation. Yeah, now we go to palpation part. Certainly we do inspection first. We can find some part of the neck have some abnormal changing, and then we palpation it. So that's palpation. Palpation, usually we stand behind the patient. Pretty similar like we checking for the thread gland. And then put the fingers, go to middle, super means above, clavicular, that means bone, fossa kind of hole in there. And deeply to checking. So pretty close our muscles there. And also we can tell the patients, take a deep breath in. And we even can checking more deeply, go to behind the clavicle bone. So that's basically we will checking for the some lymph nodules mainly in there. So that's the picture. Yeah, that's the picture here. Behind the patient and put fingers above clavicle bone on the fossa. Fossa just a big space there. And deep brushing, tell the patient deep brushing, and then we brushing deeply. If some lymph nodule there, we will be fine. Then we're talking about some common symptoms, relationship with the neck and the head area. So certainly people looking for the treatment, mainly they will have some symptoms. And when we're checking for the patients, certainly if a patient in which part have some symptoms, we mainly focus on that part. So that's the mainly. Common symptoms, headache. So headache can cause, we say, by orifice, can cause by eyes. can cause by nose. Like some people vision changing, and then they use their eyes long term, can cause the headache. And also sometimes some tumors growing behind the eyes, so that's our eyeball here. But if some tumors possible happens behind the eyes, they still can cause the headache. So patient headache, tell the patient checking for their eyes. And also possible they have some vision changing. Yeah. So that's eyes problems truly can cause headache. And the nose problems. Yeah, nose problems still possible cause headache. Like we talking about sinusitis. Yeah. Especially cause headache because inflammation happens in the sinus area and then cause headache. So that's truly both for the eyes and for the nose. We have some way to checking. If patient headache, we can think about checking patient's visions and to see if patient visions have some trouble same time. Thus tell the patient go to eye specialist. Yeah. But truly headache can coming from the eyes problems. And also patient with headache. We also can checking patient's nose, especially for sinuses area. Yeah, especially for sinuses area. We have two ways to checking two sinuses. Yeah, deeper sinuses. Yeah, we couldn't touching, but sometimes they still talking about the deeper of the head headache. Still possible cause headache. So we can simply checking pretty superficially. We have frontal sinuses and another big one, axillary sinuses, both sides. So basically right now we have two ways to checking for both these two sinuses. If some tenderness there, or even cause the headache, So that's basically we're talking about headache relationship with the orifice. Most problems not that truly cause the headache, but sometimes patients have toothache, still possible cause the headache. Yeah. So when people have headache, we need thinking about maybe some local reasons or orifice reasons possible cause the headache. And certainly, if patient just one side of the eyes have headache, yeah, just one side, and even some painful, like a touching kind of pain in there, that may be caused by nervous problems. But if just locally, may be caused by orifice. So that's firstly headache, headache. And certainly some severe case internally brain health disorder, like some tumors inside of brain, that will cause the severe kind of headache. And also possible patient same time vomiting, nausea, and even dizziness. So even just one symptom, headache, we need thinking about lot of organ or tissue relationship with. So that's pretty common symptoms, relationship in the head area. And then vision changing. And even some people, double visions. Double visions means like if they look just one people here, but they always looking like two people here. Or maybe one tree here. They look like two trees together. So that's mainly is eyes problems. Yeah, we say vision changing or double vision. Mainly is eyes problems. Like we go back to eyes visions picture here. So normally two eyes, they sending the light directly go to the brain. Both eyes will helping each other and see just like one person or one tree in there. But if they see two person or two tree in there, basically means two eyes working not like cooperate, means one eye have some trouble at least. So that's certainly we need checking more further. But generally say, any changing in the retina area and inside the eyes, sometimes fluctuation of the light happens inside the eyes. So that's mainly double vision. Yeah, this one. So mainly double vision happens. Most case happens inside the eyes. Yeah. Some lens problems or even cornea problems, like the light through the cornea, through the lens, they will happen some fluctuations, and if that part have some trouble. If patient's vision changing, or especially losing some visions, like we talked about before, that's depending which part losing the vision. If only one side, this part losing the vision, the problems may be just in here. If whole one side totally losing the vision, that's maybe eyeballs problems, maybe happens. We still talking about optic nerves here, one side, some trouble. And like we talked about before, if both eyes, same side, vision, have some troubles, that's basically the problems happens in here or maybe brings problems here. You just follow the color here, you know where the problems happens. And another kind of situation, like if something blocking here and the vision losing both sides lightly. So that's the common situation, vision changing or double vision. We need to checking. Yeah. So now we have way to checking for visions. We know where the problems happens. So that's some symptoms, relationship with the vision. changing invasion or double invasion. And hearing loss, hearing loss, earache, and tinnitus, and even vertigo. Mostly relationship with the ear problems. We say mostly, certainly, sometimes like vertigo. People high blood pressure, still possible caused, but we say mainly. So our ear have two functions. One function is hearing. Hearing loss, certainly ear problem. And earache, just local problems of the ear. Tinnitus, we say normally we have outer ear and outer ear channels and the ear membrane here, and the middle ear we have three small bones here, and then our inner ear. So inner ear we have two parts. One part is the hearing functions, like a snack, and another part, three half circle kind of tube here. So basically, the tube here control of our balance. And the lower part here is control our hearing. If normal sounds can travel in hearing normals, people will not tinnitus. If some trouble happens in there, or maybe something blocking here, people will hear some sounds not truly happens or not truly coming from outside. That we call it tinnitus. So patient either have inner ear disorder or maybe some blocking on the outer ear or even middle ear here. Patient will have tinnitus. And the vertigo, we say that may caused by other reasons like blood pressure changing, but mainly reason relationship with inner ear because the like a balance disorders. Then people vertigo. So like more fluid go to inner ear and cause the unbalanced kind of situation. Severe kind of vertigo. People even couldn't open the eyes, couldn't walking. They lay down there, but when they open the eyes, they see everything turning. It's a pretty severe kind of trouble, and the patient possible vomiting and nausea. So that kind of situation, we have a illness we call Meniere syndrome. So that's inner ear disorder cause people vertigo. So that's about ear problems. Certainly some inflammation happening there will cause ear painful situations. And the symptoms relationship with the nose, nose bleeding or maybe nose discharging, some discharging from the nose. So nose bleeding usually coming from like some blood vessels disorder from Western medicine aspective. Blood disorder, blood vessels disorder. For TCM, we say mainly some heat inside, then cause the bleeding. So nose bleeding, and sometimes discharging. So discharging most of the time coming from like a common cold, EPI, common cold attacking. And for the salt area, salt is pretty commonly. And also some people got sounds changing, big sounds changing, horizontal. So that's people's voice box, some swollen in there, and even some nodules happens in there, can cause people sounds changing. And the salt, we still have acute one and chronic one. Acute one usually still common from EPI, like common cold, EPI evading, then people got salt. But after few days, it be relieved. It's not a severe kind of problem. But truly, sometimes people got like a chronic salt, like always feel something in the salt area. That may be internal disorder. And the thyroid gland. So that's inside of mouth, truly, we have a gland in there. So sometimes they swollen, and also we have salivary gland, salivary gland in the mouth and in front of ear. Sometimes they got swollen or inflammations, still cause the troubles. And the goiter especially go to thyroid gland, hyperactive of thyroid gland. So now we know how to checking for the night, and then we find bigger thyroid gland. So certainly any checking way here, we're talking about basically physical examination. And if we find anything abnormal, in the head area and in the neck area, we will go to patient more further examination, like a laboratory examination, like a thyroid gland disorder. We're checking the hormones level in the blood. And also, like visions, the eyes, go to eye specialist, and they have special kind of machine they can checking, including the eyes, including the ear. And the special kind of case even can go to MRI or CT scan. So we have a lot of ways to checking for the patient. But right now we're talking about a physical examination. We are not truly use so complicated examining way, but we just use a simple physical way. We still can find some like disorders, still can find like some eyes problems or ears problems. Give us some basic idea relationship with the head and the neck.